People do so much to maintain their health and fitness, especially after they are past their prime age. Whether it is exercise or eating right, maintaining a fit body is no easy task. But no matter how much some people try, sometimes they can't seem to get rid of the excess fat on their belly. This can get them feeling awkward about themselves and make them conscious in the presence of others who are fitter than them. If you're looking for a simple solution to this difficult problem, then you don't have to look too far. Tummy tucking is a short and straightforward procedure that will get you looking your best. And a visit to Dr. Rajat's clinic is all you need to put all your worries to rest.
Understand that tummy tuck, a lot of people come to me and ask that I want a liposuction and not a tummy tuck, and a tummy tuck and liposuction. The difference is liposuction just removes the fat, but it doesn't do anything to the skin. Your skin may get a bit tighter, but if you have a lot of excess skin, then you need a tummy tuck done. So a person who is either fat with hanging skin, pannus of abdomen, or who is thin, who has reduced weight but still has residual amount of laxity of skin in the lower abdomen. Those are the two candidates that they will require a tummy tuck procedure so that they get a flat abdomen with no laxity of skin. The patient comes in the morning, get the surgery done. Typically they are in the hospital for one night. They go back home the next day walking. The procedure involves exercising the lax skin and tightening the skin. You will have some scar, but we make sure that the scar is hidden in your bikini area. So in your undergarment, the scar is hidden. Nobody can see the scar. Along with this procedure, we also do something called as umbilicus translocation. So many times if you have hanging loose abdomen, your umbilicus or navel also goes too low. So we also translocate that to the thinnest portion of your waist. So the concept is in an aesthetic model, there is a waist and you get an hourglass shape. And around the thinner area of waist, the umbilicus is there, plus minus 2 centimeter areas. So that your umbilicus should be. So when we do this, we also make sure that we achieve a good aesthetic body and figure. The recovery is good. The patient can walk from next day. They have to walk with a slight bend so that they don't spread the scar, because the scar is in the midline of the body. And after around 10 to 12 days, they can walk straight. After maybe around 5 days, they can resume their job. They can go to their sitting desk jobs and resume their activities. And after 4 weeks, they can resume their cardio exercises as well.
This and many other surgical and non-surgical treatments and procedures can put you on the road to a happier and more confident life. Dr. Rajat, who is one of the most trusted names in the field of cosmetic surgery, has all the answers to your problems. Book an appointment with him today.